all of us have relationships with people, and those of us who have relationships with legislators really need to engage them and help educate them about our health care issues.
TMA doctors are on the move around the Capitol this week, urging support for important legislation and adequate health care funding in the next two-year budget cycle. Thanks for watching TMA's Legislative News Hotline for Friday, February 15th. I'm Brent Anir. Here are the headlines this week. A state Senate committee approved one of Governor Greg Abbott's legislative priorities, a bill to identify and address the mental health care needs of children in crisis. The deadline to submit new legislation in the House and Senate is close to a month away, but the bill count is already in the thousands. But first, physicians testified this week in support of dollars for health and human services. The state budget won't be decided for weeks, but the battle for health care funding is happening right now, and it's up close and personal for the doctors seeking funding for Texas patients. This week, TMA physicians testified in the House and Senate committees that would begin to decide health and human services spending in the 2020 and 2021 state budget. The House Appropriations Subcommittee on Article 2 and the Senate Finance Committee heard testimony. House Appropriations on Article 2, which covers health and human services, heard several hours of testimony this week. The committee, whose chair is Representative Sarah Davis of West University Place and vice chair is TMA physician member Representative Dr. J.D. Sheffield, heard an impassioned plea by TMA President Dr. Doug Curran. Dr. Curran urged lawmakers to boost physician payments for caring for Medicaid and CHIP patients. He said Medicaid pay has been stagnant for years. Doing so, he said, would incentivize more physicians to sign up to care for patients in those government payer programs. He said some doctors' Medicaid payments are less than half of Medicare and commercial insurance payments. Dr. Curran also called for more insurance coverage for Texas' most vulnerable patients, improving their access to care.
And about 20% of our people between ages 19 and 64 don't have any health care coverage at all. So we have to get those people some sort of coverage. So my message to them is help us fix that problem. Let's pay adequately for physicians to take care of Medicaid, and let's figure out how we get federal dollars to take care of all those people who don't have any health insurance coverage.
Dr. Curran also voiced support for House Bill 1110 by Representative Davis, which proposes extending Medicaid coverage for postpartum women up to 12 months, up from the current 60 days. Later in the week, the same House committee shifted its focus to public health.
Today, I'm testifying in support of fully funding the Department of State Health Services in order to ensure that the critical public health needs of all Texans are met.
Dr. Thomas Kim, an Austin psychiatrist and a member of TMA's Council on Legislation, testified on behalf of the Texas Public Health Coalition, of which TMA is a member. That's him seated in the middle. He urged lawmakers to fully fund the Department of State Health Services and the State Public Health Laboratory. He says DSHS needs a fully funded healthcare infrastructure to keep Texans safe and healthy.
Public health is really the people's health. And while everybody can sort of get behind the idea that a healthy people is a good in of itself, it is so vitally important to help us in terms of our economic prosperity and national security that the idea of a healthy populace is something that we should absolutely invest in, because whatever we spend today pales in comparison to what we would spend tomorrow were we not to have a strong public health infrastructure.
On the other side of the Capitol, the Senate Health and Human Services Committee got right down to business on a bill that Governor Greg Abbott deemed an emergency item during his State of the State address last week. The Senate committee unanimously approved Senate Bill 10 by Senator Jane Nelson of Flower Mound, which would establish the Texas Mental Health Care Consortium. This would identify at-risk youth and help them before they become a danger to themselves or to others. Temple pediatrician Dr. Nguyen Tran testified in favor of the bill for TMA, the Texas Pediatric Society, and the Federation of Texas Psychiatry. She says the bill will allow psychiatrists to help pediatricians and other primary care doctors more quickly address behavioral health issues in their young patients.
The first time a child, whatever age, is in the office for a pediatrician, when they have the first concern of a behavior problem, it could be expressions of anxiety or expressions of self-harm or harming other people, that the pediatrician or the family medicine doctor at that second, at that moment, can access health care by picking up a phone and asking questions.
The legislation was put forward in part as a result of the school shooting in Santa Fe, Texas last year. In the coming weeks, SB 10 will get a hearing on the full Senate floor. The deadline to file new legislation is less than a month away, but the flood of bills filed shows no signs of letting up. At last count, 3,288 bills have been filed during the 86th legislative session. 2,267 of the bills are filed in the House and 1,021 bills are filed in the Senate. The House just began referring bills to committees this week. TMA is tracking more than 530 of the bills that could affect the practice of medicine and patient care in Texas. March 8th is the cutoff date for bills to be filed this session, and we expect a few thousand more bills to be submitted before the deadline. We will keep you posted. Here's a quick tip. If you want to continue to receive the latest news from the Capitol, make sure you are signed up for TMA's Legislative Hotline email report delivered to your inbox via Texas Medicine Today. Here's how. Click on texmed.org/hotline. Then click on Subscribe in the first story. On the next screen, check Healthcare Issues in the Texas Legislature like this one is checked. That's it. You'll receive Hotline daily electronic reports in Texas Medicine Today. Tell your TMA member friends. That's all for now. Please share this video with your TMA member friends and get the latest updates from TMA on Facebook and Twitter. I'm Brent Anier. Thanks for watching, and please join us again next week for TMA's Legislative News Hotline.